We need to ensure that the power supply is plugged in before we begin. We need to explain to the patient before we start. We're now going to roll the patient using the weight transfer technique. Apply a cover on top of the hover mat, and this is just a waterproof cover that protects the hover mat. You need to attach the safety straps loosely. Once a patient's on the hover mat, you need to make sure that they're centred before you inflate. We're going to now plug the air supply in. There should always be somebody on the air supply button to ensure if there are any problems that can be turned off fairly quickly. You need to attach the safety straps loosely. You need to make sure that they're centred before you inflate. Start inflation with valve 1 until it's fully inflated, then move on to valve 2, 3 and 4 consecutively. There should always be somebody on the air supply button to ensure if there are any problems that can be turned off fairly quickly. Explain to the patient what's going to happen. Once the hover mat is inflated, 2 staff insert the PATS fly. When transferring patients using the hover mat, the bed needs to be the same level or slightly lower. Ensuring all brakes are on, you move the patient across feet first and then head. And this needs to be done in a very slow and careful manner. Once the patient's across to the other bed, you can pull the PATS slide out. Before you deflate, always make sure the patient's centred in the middle of the bed. Now, as you've noticed, the bed is actually lower than what we usually recommend, but that's as high as the Hoverjack goes, so we are doing it in a very safe manner and it's quite easy to do. Make sure all the air is deflated before packing it away. Do not jump on the Hoverjack to deflate. Once removed, it can be wiped down with alcohol-based wipes. Unless it is soiled or infectious, it needs to go to the laundry following the customer-owned goods procedure. Ensure department and campus name is attached to the docket before it is sent to the laundry.